Hello everyone, Dr. T here with Tuesday's Q&A. I'm going to jump right in. Dr. T, I want to go swimming. However, my vagina breaks out in hives every time I do. What can I do to stop this from happening? So, hives is an indication that you're having an allergic reaction. What you can do to inhibit this reaction is to take some Benadryl before you go swimming. That should resolve it. Dr. T, I need to know if it's safe to breastfeed. My baby's 3 months old and I've been diagnosed with pylori. So, pylori is a bacteria that's usually found coming from the stomach lining, commonly from ulcers. The treatment is antibiotics. I recommend that you discontinue breastfeeding because the pylori itself, the bacteria, can transfer through the breast milk, as can the antibiotics that are probably harmful to your baby. So, discontinue breastfeeding until you've completed the treatment and a few days after. Dr. T, I have a question about my fertility. I want to have a kid someday and recently found out that my uterus is small. I've been told that it's 5.5 centimeters. Can I still have a healthy pregnancy? What can I do to heighten those chances? That is unusually small for a uterus size. You could still get pregnant, of course. What you would be considered as high risk. They're going to monitor you closely to make sure that there are no abruptions to your uterus and to make sure that the fetus has enough room to grow properly. So just be prepared that you will be seeing the doctor more than usual. Dr. T, hello. I've been having a burning sensation for 3 weeks now after I pee. No other symptoms, but a slight burn when I pee. I've not had sex in over a month, and I've had no pain in my back or lower abdomen. My urine is clear, no smells present. So it sounds like you were thinking that it could possibly be a UTI. It could still be a UTI. You can get an over the counter test for that. What I would recommend you do, though, if you're not wanting to see a doctor, is try eating 2 garlic cloves chopped up in at least 2 of your 3 meals a day. Do that for 7 to 10 days and see if your problem resolves. If it doesn't, I would recommend you be seen. Dr. T, can a woman with a UTI and a yeast infection have symptoms similar to herpes? So, in short, yes, the combination of the yeast infection symptoms and the UTI could present similarly to herpes. However, as you know, herpes is something that you have continuous breakouts from every now and again. So, the only way for you to know if it is herpes is to get tested specifically for herpes. I would hate for you to assume that it's not herpes and then, not be treated. Hi, Dr. T, please help. I've had breast cancer before. I'm feeling very tired, which could be due to menopause and a lack of estrogen. I'm thinking about taking something to get my energy back and to balance my hormones, but I don't know what to do. I'm 68 years old, and this has been going on for the last 10 years. So it could possibly be and likely due to menopause, as you suspected. It's kind of a late onset, but it's very possible. What I recommend you take to give you energy and balance out your hormones is maca, preferably organic red maca. That is best for women. And if you have any questions whatsoever, do give me a call. Hi, Dr. T. I recently had a miscarriage a few days ago, and my husband and I are devastated because this is our second. My doctor told me 2 weeks ago that my progesterone and potassium levels are low. Do you have any idea what I can take to bring these levels up so that I can hold my future baby? First, I'd like to say I am genuinely sorry for your loss. I know it's very hard. On the bright side, I do have something that I'd like to recommend for you, and it's something that many women, specifically pregnant women, do not know about, and that's pomegranate juice. Pomegranate juice has a multitude of benefits for the pregnant woman. So, an 8-ounce glass alone has over 500 milligrams of potassium. So, I recommend that you get some 100% all organic pomegranate juice. And additionally to the potassium, it encourages the placenta to produce progesterone, which is necessary, as you know, for maintaining the pregnancy. It also supports cell growth, and it's going to protect cells against damage, which means in turn it's going to decrease the likelihood of cell mutation that results in fetal abnormalities. That is essential to know. So drink as much as you can. You can't drink too much, and I hope you have better results in the future. And of course, if you have any questions, don't hesitate to reach out. Dr. T, I have PCOS. My period has been very irregular. I had it around the middle of last month and had unprotected sex in the beginning of the month. I'm not on any contraception and any medications. I don't have any symptoms of pregnancy except the period issue, and I feel lumps when I palpitate my pelvic region, like wavy lumps. Well, the lumps are likely because of the cysts. That's normal when you have PCOS. PCOS does make it at times more difficult to become pregnant, but it's not going to necessarily prohibit you from becoming pregnant and maintaining a healthy pregnancy. So, I'm going to recommend that you take a pregnancy test, take 2 pregnancy tests, do them on 2 separate days, get 2 separate brands, use your first morning's urine, and if you have any other questions, feel free to reach out. Dr. T, I am a 16-year-old male weighing 180 pounds. I occasionally have an extremely painful itch in my anus and genital area. It feels sometimes like stabbing needles, and it randomly occurs probably once every couple of weeks, and it lasts up to 4 hours. I've managed to ease the pain by applying some toothpaste to the area, which provides a cooling sensation down there and also drowns out the itch. Recently, I've noticed that the toothpaste is doing less and less to ease the pain. It also affects my ability to get an erection, though I'm still a virgin. What is this, and how can I never experience it again? Well, this sounds very unfortunate, and I'm sorry you're experiencing it. I don't know how long you've been experiencing it, but you definitely need some testing because you're not sexually active. Like you said, we can rule out an STD. However, there is cause for concern regarding your bladder and some other issues that it could be caused by, which are going to require testing. This is nothing that I can diagnose through a message, unfortunately. However, I'm not sure where you got the toothpaste remedy, but you can use aloe vera, and you can also order our endo oil, which is great for itching, great for burning, and great for all sorts of wounds. So that would be my recommendation until you're able to get a doctor's appointment. Now, I would like to let everyone know that this Thursday, the Healthy Tip, we're actually going to be speaking about ED, which is erectile dysfunction. So if you want answers and tips on how to eliminate that and how to treat it naturally, tune in. And I will see you then. Don't forget to like and subscribe.